Good morning, everyone, and welcome to our first ever virtual HIE Summit. We're very pleased that you've all joined us today. We have more than 220 registrants for today's meeting, and I'm sure some of them will be in and out during the day, but really pleased with the response we've gotten in this very unusual year. We would much prefer to be meeting with you all in person today. There's a lot of value, I think, in making some eye contact with our customers at least once a year, but this is life in 2021, unfortunately. Joining me today in the studio are Steve Rotman, our COO, and Amy Donor, our executive assistant. They'll be assisting us fielding some of the questions that come in and helping everything run smoothly today. Also joining us virtually are Laura Witter, Keith Hogan, and Cheryl Johnston. Many of you are familiar with them as you've worked with them in terms of implementing, bringing on data and troubleshooting. So we're glad to have them here virtually. We have a lot of material to share today and a great lineup of speakers talking about their experience with Wishin. You will have an opportunity after every one of the sessions and during the sessions to log in and share questions in the chat, and we'll take care of addressing them after each of those sessions. So we encourage you to take advantage of that. We really want this to be an interactive meeting, even though we are obviously physically distanced from each other. So are the slides up? Are the slides up?
They're working.
Okay. Just going over the agenda for the morning. After I'm finished here, we'll hear a short message from the Wishin Board Chair, Dr. Bob Donnell. Following Bob, we'll hear from Dr. Tony Thrasher talking about Wishin in the context of the Milwaukee County Behavioral Health Division. Following Dr. Thrasher, we'll hear from Sarah Morgan, who is from Molina Healthcare. And then our partners from Patient Ping will share some information about the new Medicare Conditions of Participation rule that goes into effect on May 1st. That's not that far away. I'm sure you'll enjoy hearing about that and understanding how Wishin and Patient Ping can help your organization comply with that new rule. We'll take a lunch break after that and come back in the afternoon and hear about the use of Wishin in the context of correctional health care from Bob Martin. Bob Martin from WellPath. And we'll also hear from Chris Elfner, one of our newest board members, in the afternoon about the Brown County Population Health Collaborative. So the big news then, the rest of the afternoon is us introducing you to Wishin 2.0. This is big news, and you'll want to stick around for that. We'll preview that a little bit in this morning session, but then we'll get into much more detail this afternoon. And I think all of our participants and potential participants are going to be pleased with the news about the new version of Wishin that we'll expect to launch later this year. But before we're going to look ahead, let's look back at 2020. Unusual year for all of us, obviously. But we kept things moving. We added many new data contributors. We brought on the Wisconsin DCTS facilities. These are the DHS operated healthcare facilities like Mendota, Winnebago, and several others. I think there are 11 total. We brought on WellPath Correctional. We're going to hear from Bob Martin later. We added some new data types from existing participants like Advocate Aurora with their CCDAs. We're really happy about launching the Athena Hub. We've done that with one client, but that's really important to any other organization that's on Athena. And now that that hub is in place, we can easily add new clients who are using the Athena EHR system. And we'll also talk about in a minute the catch safety plan in the project in Ashland County. We brought on 6 new payers with their member files, and you'll see them there. The big one on this list, I think, is the addition of the CCDAs from Advocate Aurora. That was a huge improvement in terms of the data available. CCDAs, for those of you who aren't familiar, are the electronic care summaries. They came out of the meaningful use rule, and these are the documents that were intended to inform transitions of care, a summarization of care when a patient is transitioning from one venue of care to another. And of course, many of those transitions are unplanned. And that's where an HIE like Wishing comes in. We can take those CCDAs in and make them available when they're needed, when a patient is accessing care at another location. And we hear time and time again from our participants how valuable having access to those CCDAs is. So that was a huge improvement in terms of the data available in our network. So let's go to the next slide. And you'll see the impact there of the addition of the Aurora CCDAs. Of course, there were others in there, but in 2020, we more than doubled the number of CCDAs in the Wishing network and available to our participants. And that curve is just going to keep going up as we've got a number of participants who are about to do the same thing. And we're just very excited about that because, again, we hear so much about the value of CCDAs for organizations to whom care is being transitioned. We mentioned the 6 new health plans that we added, and in other cases with existing health plans, they've added new members to the Wishing platform, and that resulted in a huge jump in the number of members whose health plans are participating. So it's a 70% increase in 2020 and a 150% increase since 2018 when Wishing Pulse was made available to health plans. Many of you will remember that before 2018, the only way health plans could participate with Wishing is through the patient activity report, the daily notification of emergency department and inpatient encounters for their members. So we see that trend continuing in the future. Payers are definitely seeing a growth in value in participating in Wishing, and that's reflected in these numbers. Of course, the COVID-19 outbreak was a big part of our story in 2020, and as it was for everybody who is participating today. In the middle of March, just about a year ago right now, we heard from the Department of Health Services, the Division of Public Health, asking us if we could help them supplement the clinical data that they routinely collect under the sort of mandatory public health reporting, so they could be better informed about the progression of the outbreak in Wisconsin and learn more about the other conditions that might be complicating patients' ability to fight off the infection. And so we eagerly said yes, we would love to help, and very quickly set into motion the process of getting that done. One of the complicating factors there was under our standard participation agreement, that kind of sharing with the the Division of Public Health literally was not permitted. So we needed to reach out to all of our participants and ask them if they would allow us to share their data for this purpose in this way. And we were very gratified throughout that process to hear the eager agreement among our participants. Most of them said yes. Most of them said yes immediately. All of them that we sought out did say yes. And so that was, I think, an example of how healthcare organizations can work together, and Wishin could make information available from all of them, bring it together in a way that's really valuable and important for the public health of Wisconsin. So what DPH asked us to do was create 4 rosters: COVID positive, COVID like, COVID recovered, and COVID deceased. And so we would update those rosters every day based on clinical criteria that came from the CDC and others to put patients in one of these 4 categories. And then every day we would deliver clinical data for anybody who appeared on one of those rosters. We were able to stand that up in about 5 weeks. And then from that point forward, through the end of the year, we were able to deliver daily reports to DPH and give them a much better, a much more comprehensive look at what was going on with the COVID-19 outbreak in Wisconsin. Other accomplishments in 2020, we went live with our Catch program in Ashland County. Catch is an initiative in Ashland County dealing with mental health safety plans. And you can think of safety plans as kind of a specialized advance directive where folks who are vulnerable to mental health crises develop a safety plan, meaning what they would like to be done for them in the case of a mental health crisis. They develop that safety plan, and we use Wishin as a transport mechanism to give the people who need access to that safety plan easy access to it. The patient themselves direct who should have access to it, and the thing that makes this a little different is we're not talking exclusively about healthcare providers. We're talking about others in the community like law enforcement or folks from the public schools. And so we actually had to develop sort of a walled off area of Wishin Pulse to ensure that the folks who needed access to that safety plan would have it. And as I said, we went live with that in December, and really pleased that we reached that milestone. And we feel fairly confident that we could replicate this project in other localities. Ashland County isn't the only county that has mental health crises and a need for the community to support folks in that situation. So we expect that we'll have a lot of lessons learned from this first time through, and perhaps can make it available in other counties in the near future. So next slide. We had a lot of interest in Wishin from municipal health departments, and I think that it's pretty obviously an outgrowth of the COVID-19 outbreak. We made access to Wishin Pulse free for a time during the middle of 2020, and a number of organizations like local health departments took advantage of that, and they stayed with us. They saw value almost immediately, and we're very pleased that happened, and we think this is another area of growth for us in the future. If there's value for these public health departments, there's probably value for others, so we expect that trend to continue. We also added many hospice and home health organizations during 2020, and I'm sure COVID-19 was part of that story as well. But when you think about home health and hospice, and local public health. These are organizations that you might think of as sort of on the fringe of the healthcare delivery system, and there aren't really good mechanisms for clinical data to be shared between these organizations and what you might think of as the more traditional delivery the providers in the delivery system. So this is a perfect niche, I think, for Wishin Services, connecting organizations like home health and hospice, like local public health, with the more traditional healthcare delivery system. There's huge need for it, and we're really pleased that we were able to bridge the gap. And again, we think this is going to be a trend that continues. More home health, more hospice organizations are likely to come on board in the near future. In terms of other accomplishments, we are sprinting for the finish line on our DHS / Medicaid MCO care plan project. This is something that we started a while ago. It was an outgrowth of a contractual requirement that DHS had for their Medicaid managed care organizations who have SSI members. Those plans are now contractually required to develop individual care plans for each of their SSI members and share that information, share those care plans via Wishin. And we are, as I said, nearing the finish line on this project. There's some similarities with the Catch safety plan approach. Again, allowing those who have a need to access this information in the context of caring for a patient in one way or another to be able to access that through Wishin. So we are in pilot and test right now. We'll rapidly add the other organizations right after that, and expect that finish line will be late spring, early summer. And we also are very close to going live with payer medications. We've, for 4 or 5 years, maybe 6 years, almost 6 years now, included medications that are paid for by Medicaid. And our goal is to add medications paid for by other payers to the Wishin Pulse Community Health Record. And we're very close to finishing that up. We think there's going to be a huge increase in value to our users, our customers. We hear time and time again how clinically valuable it is to be aware of patients' medication history, and in some cases, lack thereof. Medication compliance and adherence is obviously pretty important, and if that information isn't there, that tells clinical decision makers a lot of what they need to know. So we reached several important milestones in 2020, and these are cumulative numbers. We crossed 1 million Pulse logins since the beginning of time. We exceeded 2 million patient queries. So over our complete history, each login results in 2 patient queries on average. And our users have now accessed more than 10 million records through Wishin Pulse. So obviously there's value there. There's information that's needed for clinical decision making and care coordination. And I think what's significant about these numbers is they're on a pretty steep incline right now. Clearly, when we were just starting out, when we had relatively few participants and relatively little data to be found, there wasn't a lot of growth in those numbers, but in recent years that has gone up quite a bit. And again, this is a trend that we see continuing in 2021 and beyond. This slide shows you kind of on 2 different scales how the number of registered users and the number of records access has changed since 2016. And you'll see that the number of users is increasing, but not radically so. But the amount of data they're accessing is increasing by quite a bit. So this is something that tells us that we think that they're finding value. Our users are becoming more experienced with the tool. They know what they're looking for, and we think they're increasingly finding it. The numbers tell us that they are spending more time and looking at more data through Wish and Pulse than in the past, and we're very pleased about that as well, because again, we think that's a measure of value. So looking ahead to 2021, a couple of things we want to make note of. There are some policy changes regarding health information exchange. The governor introduced his budget bill a few weeks ago, and in that budget bill is a $655,000 appropriation for an HIE grant program. And this is something that would be administered by the Department of Health Services, and it is aimed at helping new data contributors connect to the network. In a number of situations, the initial cost of connecting to the network is sometimes daunting for especially small organizations, and this grant program is aimed at helping that happen, building out the network and pointing some assistance at those who need it most. The budget bill is just introduced. There's a long way to go before it reaches the finish line, and we'll be keeping our eye on how that's proceeding, but we regard that as very good news, an indication that our public policy leaders are seeing value in building out our network, and we're very grateful for that. Also, there are new Medicaid contract requirements in the existing, the new contracts. Now, Medicaid health plans are required to participate in WISHN, not only Wish and Pulse, but to take advantage of our notification service, the patient activity report, or the notifications available through Patient Ping, our partners. So we have nearly every Medicaid health plan right now. Obviously, as a result of this mandate, we're going to have all of them very soon. There's also, some of you may have heard about the COVID legislation that passed last spring. There's a provision in that bill that creates a pay-for-performance incentive for hospitals to participate in WISHN. And that's not just new hospitals, that's any hospital that participates in WISHN. So this might be regarded as kind of a reward for the hospitals that have chosen to participate in WISHN, and an incentive for those who aren't to join the network. We're still waiting for final rules on our final criteria for this program. It does start in 2021. What we do know is the legislation anticipates that those who are participating in health information exchange will get some kind of incentive for doing so, and it will be variable. The degree to which they are sharing data, we believe, is going to result in a variance in the kind of incentive they receive. So essentially, if there's greater participation, there's greater data sharing, the incentive will be higher. So we expect that in about a month we'll see the final criteria for 2021. But again, we regard that as a important and positive development. Again, the state saying it's very important from a public policy perspective that we build out this network and maximize the amount of clinical data that is available through WISHN. And again, it's kind of a reward for the hospitals that have done the right thing and made their clinical data available through WISHN. We will also soon have a new use case that will take advantage of the data that we have in the WISHN network. We call it the life insurance use case. It's not exclusively for life insurance, but the idea here is that we can automate the process of acquiring medical records when we have a situation, for example, when somebody applies for life insurance. Typically, the life insurer will ask for an authorization from the patient or the applicant to obtain their medical records as part of the application process. And instead of playing that out in a very manual way and contacting hospitals and health systems and doctors individually and asking them to manually fulfill those requests, the idea is we can use the technology and the network of Wishin to automate that process. So we expect that new use case will probably be effective around July 1st. And again, we think this is a win-win-win. This is a win for our participants who won't have to manually fulfill those requests. And it's a win for the insurance applicants where their application can be processed so much more quickly. And obviously the complexity of the acquisition process for the insurers themselves is greatly reduced. We're seeing this use case play out in a number of states, and the HIEs that are operating in those states have been doing this for some time. And we think, again, it's a win-win-win, and we're pleased that we'll be able to make that available in a few months. So our biggest news today, as I mentioned before, is that we're unveiling Wishin 2.0 today. And there's so much to cover. We'll scratch the surface here this morning. We'll get into a little bit more detail this afternoon. But we're going to have an ongoing dialogue with our customers as this process plays out. What you need to know today is that we are transitioning our technical platform this year from the HCI Medicity platform to a hybrid solution. And the technical foundation will be provided by Velatura and KPI Ninja within the next several months, certainly by the end of the year. What we're looking for is more and better functionality, a more user-friendly system, and a more future-focused system that will serve our needs not only now but into the future. We went shopping for a new partner back in June. We went through a formal procurement process, and we invited several of our customers and stakeholders to help us with that process, to help us evaluate our options. And we're really pleased that so many of our stakeholders and customers agreed to help us out. It's a tough slog. It's highly technical, and there's a lot of material to read and process, and their help was invaluable, and we salute them for putting in the time. We were, throughout the process, I think it's fair to say that the two vendors, Velatura and KPI Ninja, rose to the top. And it was kind of neck and neck between them. And what we ended up asking them to do is work together on our behalf. We are convinced that this hybrid approach is going to bring the best of both worlds to our customers, and work has already begun. We're publicly announcing it today, but a lot of the preliminary work has taken place. To oversimplify it a bit, how this is going to work is that Velatura will function as the back end of the process. They're going to take in the data. They're going to process it, do the patient matching, stage and store the data. And KPI Ninja is going to be the front end. Again, this is an oversimplification, but KPI Ninja will be responsible for the Wishin Pulse portal and the user experience of the community health record. So they'll be drawing on the data that Velatura takes in, processes, stages, and stores, and will make available the new and improved Wish and Pulse version of Wish and Pulse when we go live with that. You're going to, as I say, you're going to hear a lot more about this process from both of our new partners this afternoon. And we have some goals for this transition. We recognize that this is going to be a change, and even good change can be complicated in some cases. And our commitment to our customers is to minimize the technical burden and the impact of the transition. We think it's not zero work, but we're confident that we've made put together a plan that will minimize the impact on our customers. And again, we'll talk more about that process this afternoon, and you'll be hearing much more from us in the coming weeks and months as this process plays out. I'm confident that when all the dust settles, we're going to be in a better place, and our customers will find that the technical lift on their side is pretty minimal. We definitely, we want to improve the customer experience. We want to modernize the Wish and Pulse user interface. We want to deliver more of what you want to know and where you want to see it. And we'll see a little demonstration of the new platform this afternoon. Those of you who are veteran users of Wish and Pulse will be delighted by what you see, I'm confident. So that's going to be one major improvement that our customers will see. We also wanted to expand the options for automated data delivery. Some of our customers are already getting data through an automated query and retrieve process. So that information is being delivered behind the scenes into their EHRs in an automated fashion. We'll be able to do that and many more options for automated data delivery. We're trying to meet our customers where they are. There's more than one flavor of health information exchange. We are aware of that. We've been offering a little bit too much vanilla over the past several years, and our commitment is that we will seamlessly integrate with your electronic health record systems and other data sources that you might be using. So a lot for our customers to look forward to, and you'll hear more detail, as I said, this afternoon. Another goal that we have for the transition is to be in a better position to anticipate and respond to our customer needs. There are some we know about. There are some that none of us knows about. We are acutely aware that there are use cases and ways to experience the data that nobody's thought about right now, but it's very important that our technical architecture supports an ability to innovate, right? And stage our data and have a technical backbone that allows new use cases and new displays and new ways to analyze data. A big difference from our existing architecture to our new architecture will be the Amazon Web Services Foundation. That's critical and foundational to everything we would want to do in the future. So that's a huge plus. We're so impressed by the technical expertise of our new partners. They've been there, they've done that, and one term that keeps coming to my mind, and I think the minds of the staff, is these new partners are problem solvers, and that's a great place to be in for us. There are always problems, there are always pain points that Wish and our customers need to solve, and they're positioned to do that. And of course, we want to focus on innovation. The world moves quickly. The market environment changes. The technical environment changes. If there's a need, we need to be able to respond on behalf of our customers. We think our customers look to us to be the experts to help them navigate the world of interoperability and the new regulations they might be facing. We're going to be in so much better of a position after this transition to help ourselves and to help our customers in the coming days and weeks and months in the new environment that we know is coming, and we'll be ready for it. So that's a very quick rundown of a review of the events of 2020 and what we're looking forward to in 2021. John mentioned a little bit about how our meeting is going to work today. I'm just going to come back to a couple of those points. Obviously, we don't have the ability to chat in person, and we regret that, but we're trying to make the best of it. As I said, there's an opportunity for everybody to engage and ask questions through the chat tool. Most of all of our presentations, other than this one, are pre-recorded, so we'll be addressing the questions at the end. There's somebody involved in each of the presentations that will be available to respond to those questions after the recording ends. So we encourage everybody to engage. We want to make this as interactive as possible. With regard to the schedule, we have scheduled start times for each of the sessions, and we're going to stick to that schedule because we are aware that some folks aren't joining us for the entire day and they may be interested in a specific session or two. So in the event any session ends early, we're just going to take a break and we will move to the next session at the scheduled time. So if we have those breaks, there's an opportunity for you to interact with each other, interact with our sponsors, etc. There are a lot of really interesting tools that are available through the Hopin platform, so we encourage you to take advantage of that. One thing you can do, as John said, is to engage with our sponsors. We're so pleased that so many of them have agreed to help us out with this presentation today. You can go to their virtual booths by clicking on the Expo button on the screen. I believe that's on the left, on the bottom. So we encourage you to stop by and say hello to our sponsors and thank them for helping us make this session happen. At the end, we'll have some prizes. We always do that, so stick around for the prizes. We'll do some random drawings and give away some prizes at the end of our session today. And finally, another specific thank you to our sponsors, Image Trend, the Rural Wisconsin Health Cooperative, one of our new partners, Velatura, and the other one, KPI Ninja, Health Data Engineering, Heartland Business Systems, our partners at Patient Ping, HRT Consulting, Beam Healthcare, and Metastar. Thank you all for making this session possible today. Thank you all for joining us, and we look forward to a really good meeting and a lot of interactivity.